Dr. Sreedhar Potarazu from Vital Spring Technologies is live with us from D.C. Doctor, you've covered Obamacare extensively for us on this program, and that's what you do for a living, essentially. Now, we hear that McKinsey says 1/3 of employers drop Obamacare because they would find it cheaper to pay the fine for not offering health care to their employees than actually going with Obamacare. Is that accurate?
Stuart, don't you hate I told you so's?
Yep.
I was here, as you well know, many a time predicting several months ago that employers are going to do just this. It's going to be far more sensible for them to not have to live up to the expectations, especially for those who have low-wage workers, to
What, is it sensible financially? Is that what it is?
No.
Obamacare means sensible for them to drop Obamacare and pay a fine? That's sensible financially for them, is it?
Of course, because if they have to increase the level of benefit right now and not know how much they're going to be responsible for, it's going to be far easier for them to pay the penalty and force these individuals to go into the exchanges, which means that the 7% number that was predicted by the CBO report, according to this survey, is far more. If you're looking at 30% of the companies surveyed, and as Tom said earlier, a number probably much higher. Now, what that means for you and I as taxpayers is that if more people go into the exchanges to buy insurance, we're going to need more money than what was already shelled out to pay for the bill, because we haven't factored in that number of new people coming to the exchanges. And it also means that people buying insurance in the exchanges are going to have to shell out more money to get insurance. So that previous statement about liking your doctor and keeping your insurance, that sentence is not finished.
Okay.
Because
Doctor, let me ask you a question, Doctor, because one of the things that I'm thinking is that this may play right into what President Obama has said before, which is, this was when he was running, he wants a single-payer insurance. Isn't this going to effectively move everybody into, all the employees go into a government program and we're done with it, and he gets his single-payer insurance program?
The dynamics force the dominoes in that direction because you set everybody up for failure. You've set up the employers for failure. You've set up the states for failure. The high-risk pools for insurance have failed. You've set up the doctors for failure, so that the default plan can only be a single-payer system under these mechanics. And when you talk about the McKinsey system, McKinsey study being an outlier, I think that there are outright lies in the assumptions that we have been told that time and time again are simply being refuted by reputable firms like McKinsey. They're not outliers.
Okay, so it seems to me that in the court of public opinion, Obamacare is falling to pieces, it's disintegrating, but it is in fact not, because it is going forward. The legislation is being implemented, and it's going to continue to be implemented. I mean, there's no way around this, is there, Doctor?
So we're continuing to shell out hundreds of millions of dollars. So let me give you an example.
Yes, we are.
Hundreds of millions of dollars have gone out to the states for them to implement in the next 2 years what they need to put in place so individuals can buy insurance through these public exchanges. The states have no clue in terms of how they're going to implement these exchanges. They're sitting on the money, and their greater concern is what's going to happen in 2 years because the government money dries up. We're going to be left holding the pot, building this enormous white elephant, and who's going to pay for it? Because it's unsustainable for the states to be able to take on this responsibility, to be able to continue to pay for that, and to also be able to take on the responsibility of an enhanced or an enlarged Medicaid roster.
We hear you, Doctor. We're going to ask you to come back. We want more updates on how this thing is actually playing out and the financing thereof. Dr. Potarazu, thanks very much for joining us.